Hello, everyone. Today we're going to present the Chapter 3 of Diabetes, talk about diagnostic, complication, and treatment. There are various anti-diabetic medications designed to reduce serum glucose levels in type 2 diabetes. They are not indicated for use in type 1 or type 2 diabetes in pregnant women or in patients with acute or renal disease. Little and Rodas, 2007. These medications are classified by their mode of action: increase insulin secretion with sulfonylureas or glutamides, increase insulin sensitivity with a biguanide or thiazolidinedione, glitazone, and modify intestinal carbohydrate absorption with an alpha-glucosidase inhibitor. However, these hypoglycemic agents can cause unwanted side effects, such as digestive pain, diarrhea, kidney failure, etc. Currently, there are 3 valid criteria for establishing an analytical diagnosis of diabetes. Measurement of fasting plasma glucose, FPG, less than 7 mol/L, 126 mg per dl. Measurement of glycosylated hemoglobin, HbA1c level, if it is between 7 and 8%, and 8%. And measurement of plasma glucose greater than or equal to 11.1 mol/L, 200 mg per dl, 2 hours after glucose ingestion. When large arteries are affected, their diameter narrows and their walls harden. These are atheromatous plaques. This atheromatous plaque can become complicated by a clot, thrombosis, which develops atherosclerosis. For example, retinopathy, the presence of spotty retinal hemorrhages. Despite the development of molecules that normalize blood sugar and the improvement of therapeutic regimens, diabetes remains subject to excess morbidity and excess mortality linked essentially to degenerative tissue damage, particularly at the level of the nerves, neuropathy, kidneys, nephropathy, retina, retinopathy, and heart. The treatment of diabetes, whether type 1 or 2, is based on the need to assimilate sugar into the body's cells and provide the body with the necessary amount of insulin. Good glycemic control of diabetes mellitus is recommended to delay, or even prevent, the onset and slow the progression of complications. To achieve these goals, several therapies are available. A diet well balanced in carbohydrates, proteins, and lipids, as well as physical exercise, are essential components of the treatment of diabetes mellitus. This diabetes is also treated with insulin therapy. Insulin is used in the treatment of type 1 diabetes and in some patients with type 2 diabetes. It comes in different preparations of varying duration of action: slow, intermediate, short, rapid, and of diverse origins: human, bovine, and porcine. Each type of insulin has its own characteristics in terms of onset, peak, and duration of activity. However, this treatment can cause hypoglycemia in cases of overdose or uncontrolled diet, local reactions, lipodystrophy, and weight gain. To diagnose diabetes clinically, the main characteristic signs of hyperglycemia are an increased need to urinate, which becomes frequent and occurs night and day with abundant urination, polyuria, an increase in urinary glucose levels, glucosuria, an increase in thirst, polydipsia, a weight loss despite an increased appetite, polyphagia, and significant fatigue, asthenia. Finally, there is a new treatment or the 2 diabetes types. For diabetes 1, continuous glucose monitoring, CGM, is a system for continuously measuring glucose levels in interstitial fluid. And stem cell transplant for diabetics and diabetes 2. The contraceptive implant is a small match-sized plastic rod placed under the skin of the arm. It is a hormonal contraceptive of the microprogestogen type.